Hello, everyone, and thank you very much for joining us on Global Heat Action Day. My name's Heidi Albert, and I'm the head of the Cities Health Centre at ICLEI Africa, based in Cape Town. And today I'm joined by my colleagues Kate Strachan, who's the Deputy Director of Resilience, and Danya Petrick, who's the Senior Specialist for Climate Change and Resilience. We'll record the session and share the recording along with the slides afterwards. ICLEI, Local Governments for Sustainability, we're a global network of more than 2,500 local and regional governments working to advance sustainable urban development. And as ICLEI Africa, we work with cities and local governments across the continent to develop practical, people-centered solutions to climate, health, and urban resilience challenges. The news right now is full of the unprecedented temperatures affecting Europe, but today we're going to turn our attention to Africa, where extreme heat is already affecting millions of people across our cities. And unlike floods or storms, heat is often invisible. It doesn't leave dramatic images behind, but it quietly increases illness, stress, inequality, and deaths, and especially in the most vulnerable communities. Urbanisation, dense grey infrastructure, informal settlement expansion, and the loss of trees and natural cooling are intensifying these heat exposures. And the decisions that we make now about housing, transport, public space, and infrastructure will shape future vulnerability for decades to come. Heat is already costing lives and livelihoods. In Africa, the true burden is likely underestimated because we're still lacking strong heat health surveillance systems. But we do know the impacts are wide-ranging, affecting not only physical health, but also mental well-being, productivity, safety, and social cohesion. And importantly, heat doesn't affect everyone equally. Pregnant women, young children, older adults, outdoor workers, and people living with chronic illness or disability, along with residents of informal settlements, these are the people carrying the greatest burden. And that's why heat can't only be considered a climate issue. It is a health and equity and a governance issue, and municipalities are on the front line. Local governments are shaping housing, water and sanitation, urban greening, environmental health, spatial planning, disaster management. So heat resilience really needs to become part of everyday urban governance and service delivery. The encouraging news is solutions do already exist, and today we'll hear from an exciting panel of speakers from across the region who are helping to drive this agenda forward through research, policy, community action, and city-level implementation. And the key message for today is simple. Heat action cannot wait. Extreme heat, it's not a future risk, it's a present-day urban health emergency. So the challenge is really how can we move from evidence to local implementation? We have a full agenda ahead, so we'll jump straight in. I'll kindly ask our speakers to please keep to time, and please put any questions you have in the Q&A throughout the session, and we'll answer as many as we can. Thank you.
Okay, so thank you for the warm introductions. As I said, my name is Gloria Maimela, and I'm the CEO for the Foundation of for Professional Development, FPD. Next slide, please. And I've been asked to quickly talk about building health resilient systems and preparing communities, particularly the healthcare system for a response. So a preparedness and response topic in terms of how we're dealing with what's happening now with climate change and health. I'm not going to preach about this. Most of you know the challenges that we are facing with climate change, that we know that we've exceeded the global warming target of 1 degree Celsius, and we're expected to exceed 1.5 by 2030. We know that the African region is warming faster than the global average, despite the fact that we're not the greatest emitters of greenhouse gases. But nevertheless, we are more affected, and this is intensifying heat waves and droughts throughout the African continent. Heat exposure specifically, we know that there's been a lot of literature that shows that heat exposure increases the health impacts, especially for vulnerable communities, including specific populations, the extreme young, extreme old, outdoor workers, and healthcare workers for that matter. This is a quote from WHO that climate change could cause over 250 additional deaths by 2050, mostly in the African region, if nothing is done. Next slide, please. So it has become now apparent that we now need to address the impact of climate change on the health workforce, but also how prepare the health workforce to be able to address the impact of climate change on health. One of the the challenges that we're facing again from WHO is that Africa is projected to face a deficit of over 5 million healthcare workers. As I said, most of them in Africa. And now this is going to be compounded by the climate-related staff attrition that we're seeing from heat and extreme events. I was part of a research study that looked into the impact of heat on the health outcomes of healthcare workers, and we're finding that healthcare workers, especially the ones with comorbidities, but also the ones that are working in facilities that are that have poor infrastructure, are already being affected by extreme heat exposure. So we know that this will compound on the shortages that we will see in future. Clinics and communities endure heat and poor ventilation, and then this is impacting the quality of care that the nurses, professional nurses, and other non-clinical staff are rendering. I mean, one of the things that we did, we measured the dehydration in our healthcare workers, and we found that most of them were actually dehydrated because of the infrastructure, where they were at small, rigid, structures that were not climate friendly, but also the fact that the care itself, when they're supporting patients, there's no time to drink water and so forth, and it's getting worse and worse and worse. But we also know, and I've talked about the impact on the healthcare workers themselves, but also that there is limited health climate and health training, and that effectively reduces the ability of the healthcare workers to respond to the climate threat that we are seeing. And we know that the WHO priority is to build resilience, especially among healthcare workers going forward, to be able to address this. Next slide, please. So how does heat affect health services? This is so in many ways. I've talked about the healthcare workers themselves, but the more we're seeing extreme heat events, the more we are seeing patients who are now presenting at facilities with heat-related illnesses, and also patients who are I mean, in South Africa, for example, we have the burden of HIV. We're seeing patients who are with chronic HIV who are now getting affected. We also have patients with chronic diabetes, chronic cardiac conditions that are also, presenting at facilities, and this is already worsening the burden that we have on already fragile health systems. We've seen, as I said, fatigue and drowsiness and reduced clinical performance in the healthcare workers, and the services are burdened. There's more visits, more admissions, increased emergency demand, and also the systems, there's pressure on water, on power, on transport, and also this one of the things that we don't talk about a lot is the risk to medication and to medicines and the cold chain. And we're talking about vaccines now that we have, I mean, the immunization rate in our country are dropping, and but that's a factor of demand, but also on a system, the cold chain system that is now being rendered less effective because of heat exposure. Next slide, please. So this is just the WHO. I'm sure many of you have seen this, the operational framework from WHO that looks at that guides in terms of building climate resilient health systems with the different 10 components. But what I want to do for this presentation, just to focus on healthcare workers themselves as one of the areas that we, for at least at FPD with some of my colleagues, on the work that we're doing on building the resilience of healthcare workers to be able to respond to the climate crisis. Next slide, please. So this is just data. I just wanted to share this data from one of the research studies that we're doing in terms of what healthcare workers think is a priority for them going forward as an intervention, as an adaptation intervention forward. And one of the biggest, and you see at the top there, is providing training to health officials on heat health. And so this is data that we got for healthcare workers, that there's definitely a need for us to provide this training. And there's been a lot of discussions in many forums about how to do this. Either you do this as a short course or integrating climate change and health, or heat specifically in most areas, into curriculum, so that at the end of the day you have what we call climate smart healthcare professionals. These are just some of the interventions when we interviewed them. This was through co-design. Musa talked about speaking to the communities about what they want, and this is data from the the healthcare professionals in terms of what intervention they would think would work in their areas, all the way from individual to at facility level in terms of what they need. And we're not talking about healthcare workers at facility level. We're also talking about healthcare workers who are the community healthcare workers who are out there, who are providing services, who also need protection. And then obviously this conversation goes from individual all the way to even systems review, because it's linking with policy systems to look at the lighter uniform for healthcare workers will go a long way in terms of protecting healthcare workers from extreme heat exposure. Next slide, please. I just wanted to share with you, this is the last two slides, some of the work that we've been doing at FPD. We've developed a short course on climate change and health, and this is Climate Change and Health 101 for healthcare professionals to support the healthcare workers, but also, like I said, we talk about healthcare workers loosely, but this is also to support managers, to support environmental health practitioners, and the course literally goes on what is climate change in the first place, all the way to the different impacts, including air pollution, climate sensitive diseases, heat, and whatnot. So this is one of the course. This is an online course that we offer, but which can also be converted into in-person. Next slide, please. This is a slide, and apologies, I needed to add in some of the logos from the partners that we work with here, as the heat health preparedness response. That a course that we're working on together with the World Bank. Bradley's on the call right now, and Salga. This course then focuses specifically on heat readiness by healthcare workers. And what we're doing is that we are literally, as part of and I'm sure Bradley will speak to the heat action plans that they've been busy with. And one of the pillars of the heat action plan is capacity building. And we are now supporting that capacity building pillar, and we have developed a heat health response course that then takes healthcare professionals, prioritizing again healthcare professionals, but also working with other cadres, specifically on, again, what is climate change and how does that climate change link to heat? The need to be aware of heat action plans. We have the beautifully developed heat health action, national heat health guidelines, but we're seeing that a lot of people are not aware of and these heat health guidelines, inform some of the heat action plans. Bradley will talk about, and some of the case studies that the World Bank has been focusing on. And we want to take that learning from Ahmedabad and see how we can also develop our own heat action plans at local level. We delve into prevention and adaptation interventions that healthcare workers can think about, using the examples that I've shared with you before, but also the clinical management, because I think that's been missing in terms of what do you do when you have a patient who presents with heat stroke? How do you manage that? And also looking at operational readiness or how to protect the vulnerable groups. Last slide, I see Heidi. Next slide, please. Next slide. We missed another slide that talks to yes, here we go, the training component, how we're doing this. As I said, we are already in June we'll be starting with the training in a different, primarily in Tshwane, where we already have a list of healthcare professionals who will be coming so that they can be trained on this for 3 days. But with additional support, for example, from the Rockefeller Foundation, we plan to scale this to other districts as well, because this training is quite needed. And just to also mention that there's also an e-learning course that's linked to the course for people who are not able to attend the in-person training. And that is the end of my presentation. Thank you. Thank you, Heidi.
Thank you so much, Gloria. Really fantastic presentation and so comprehensive. And I think also encouraging that, so much is already being done. And as you say, the sort of real Question is, how can these interventions be scaled up? So really appreciate that your insights there. Thank you. And I think you segued very nicely into our next speaker. So very pleased to be able to introduce Bradley Riley. And Bradley is a disaster risk management specialist at the World Bank, based in Johannesburg. And as Gloria alluded to, Bradley's going to be speaking to us today about heat action plans in practice. So translating evidence into local urban action. Great pleasure to have you with us, Bradley, and over to you.
Fantastic. Thanks so much, Heidi. And yes, indeed, it's definitely a great segue from Gloria's presentation to this one. So yeah, great. Thanks, Heidi. The name's Bradley Riley. I am a disaster risk management specialist at the World Bank. You can go to the previous slide. Can go from the start, yeah. So I'm a disaster risk management specialist at the World Bank, and I'm going to be really talking about heat action plans in practice, specifically in South Africa, and the work that we've been partnering with the South African National Treasury City Support Program on. So, I mean, in this talk, I want to showcase heat action plans in practice, as I say, in particular, our work that we've been doing across 3 cities in the Gauteng province, and how we turn heat from risk into response, and how this model we are hoping can be translated and scaled across South Africa. So next slide. So, I mean, this work led to what we are calling the Gauteng Heat Action Plan and Early Warning System pilot. So it's basically, in short, it's the development of a heat early warning system and action protocol for the Gauteng city region, which includes 3 cities: the city of Johannesburg, the city of Tshwane, which is Pretoria, and the city of Ekurhuleni. So this heat action plan and early warning system protocol includes a concept of operations and an actionable roadmap. So it's looking at the issuance of alerts alongside health sector guidance and other sector-specific responses. So through this approach and through this pilot, we brought together a group of stakeholders in a technical working group working across the local, provincial, and national agencies in South Africa to co-develop this heat action plan for the 3 cities. So we actually coined this working group, and for those South Africans on the call, as a bring and braai. And basically we coined it a bring and braai because everyone has something to bring to the table. So at a braai, someone brings the meat, someone brings the potatoes, someone brings the salad, but everyone in this working group and in this heat action plan, everyone has something to bring to the table. So we coined it this bring and braai approach, and it's been really successful over the past few years. So this heat action plan is modeled after, and Gloria had mentioned it, after the very successful Ahmedabad heat action plan, which was developed in 2013 after a deadly heat wave hit India. So we're using a very similar 4-pillared approach for this heat action plan, and it focuses on 4 key pillars. The first one is on the early warning system and emergency response protocols. So what triggers need to trigger our early warning system, and what are the responsibilities and protocols that need to be followed. I see something's happened to the slide. There we go. The second pillar is on public awareness and community outreach. So ensuring that the public are educated and aware of an incoming heat alert and what they can actually do to take action. The third one is on capacity building for healthcare professionals. How can we build capacity for our healthcare professionals, help them understand and provide them training now to identify, prevent, and treat heat-related illnesses. And then the last one is more on heat exposure reduction in the built environment. Next slide, please. So when we wanted to develop this heat action plan, the starting point was understanding the risk. And I think Musa had also spoken about it, what happened in Dar es Salaam, is understanding the risk and understanding the heat impact. So we wanted to understand how hot is too hot. How does heat impact health? And at what point does it become dangerous? So we analyzed the relationship, and we undertook a study with the South African Medical Research Council to understand the relationship between temperature and mortality, to ultimately look at heat health thresholds. So at what threshold does mortality start to increase? So this relationship showed that once temperatures exceed around 38 degrees Celsius, mortality increases by around 50%. So this gives us a really clear and evidence-based foundation to develop these heat health thresholds that could ultimately lead to the development of a heat health early warning system. Next slide, please. So using the results from the study and using this evidence, we are looking to define a very simple traffic light early warning system for a yellow, orange, and red alert. So we are working with the South African Weather Service, and we're linking to this to the existing South African Weather Service forecasting toolkit. And we are proposing these thresholds in an operational model for how this can actually be piloted and look like within the Gauteng province. So we can see on the graphic on the left there, this is just the proposed operational model of what it will look like within the Gauteng province. And on the right there, we have a nice graphic just showing the different alert levels, the yellow, orange, and red alert levels, what those temperature thresholds are, as well as the health impact. And ultimately, what we are trying to do here is we are trying to also link this with the existing disaster management authority coordination function, which within the province, so that once the South African Weather Service can trigger alert, there are clear roles, a coordination mechanism, and decision making can flow when an alert is triggered. Next slide, please. So what's super important is the warning is only useful if it actually triggers action. So alongside this early warning system, we are also piloting some real on-the-ground responses. And I'm just going to mention three at quite a high level. So the first one is a public awareness campaign. So we've actually developed a communication strategy and a messaging toolkit for the Gauteng province that can actually be scaled across South Africa. And this has also been tested through community level activations in 3 informal settlements in the Gauteng region. And it's focused on behavioral change among the vulnerable groups. So it's to provide the messaging and to provide the education on what to do when a heat alert has been triggered. The second pilot activity we are focusing on is this healthcare capacity building. And this really links up nicely to what Gloria was speaking on. And we're working with Gloria and FPD and Selga on rolling out this in-person training for medical healthcare professionals, particularly at a primary healthcare facility. So for your clinic staff, your community healthcare workers, and emergency responders, to ultimately help them understand on how to identify, prevent, and treat heat-related illnesses. Seems like there's something wrong with the slide, but I'll just carry on. And alongside this in-person training, we are also looking to leverage this e-learning component that Gloria had mentioned. And this is really being led by FPD, and it's going to be implemented in June, I believe, Gloria. So in the next month or so. So we're really excited to see how that work is implemented on the ground in the primary healthcare facilities, as well as that e-learning component. And then the last pilot activity that we are focusing on is on the built environment and looking at some exposure reduction interventions, looking at shading, cooling, and greening interventions, and also embedding heat within more longer term urban planning across both the formal and informal areas. So that's more on the long-term resilience within the built environment. Next slide, please. There wasn't a lot of time to really speak and unpack heat action plans in practice, but I wanted to kind of end off with this last slide in the key steps for developing a heat action plan. So we kind of nailed it down to 4 key steps. So firstly, we need to identify the risk. So what is the heat hazard? Have there been any recent events within our city, within our country that we can speak of? Who are the vulnerable populations, and what are the observed health impacts? The second step is linking heat to its actual impacts. So looking at the health and mortality data, looking at critical temperature thresholds like we did in the Gauteng case. The third step is now defining alert and responsibility. So based off those temperature thresholds, what alert levels can we use to trigger a yellow, orange, and red alert? What are the roles and decision making that needs to be made? And what are the sectoral actions that need to be triggered once a heat alert is activated? And then lastly, it's about implementation. It's about testing. It's about improving. So we implement the heat action plan. Then we go to post-event feedback and a monitoring and evaluation. We learn from what has been successful, what hasn't been successful. And then we adjust the thresholds, we adjust the protocols, and we adjust the heat action plan and improve it over time. And ultimately, what brings us all together, and the biggest lesson that we've learned throughout this process, is about institutional coordination and shared responsibility. So this whole bring and buy analogy that we speak of, it's about the shared responsibility that everyone has a role to play and everyone has something to bring to the table. And I'll just end off with two more slides just to show you what this has taken over the past year and a bit. So you can go to the next slide. So this is just a quick snapshot of us working towards action. So there's been one goal. There have been about 12 different working group sessions, over 18 months of collaboration. Almost 37 institutions have been involved in the process and over 100 representatives. And if you go to the next slide, you can actually see the working group in action as we are bringing this heat action plan alive. But that's all from my side. There was so much more information to share, but happy to answer any questions that follow. Thank you so much.
Fantastic. Thanks so much, Bradley. And I think, as you say, I'm sure there's a lot more information that participants would really value in terms of digging into the details as well. So maybe we can also think about maybe some follow-on sessions if that would be of interest. And I think sort of that last slide, or the second to last slide, really sums it up in terms of the level of effort and coordination across so many different stakeholders that it takes to sort of bring these heat action plans to life. So yeah, really appreciate the presentation and sharing with us. Thank you. So we'll move straight on to our next speaker. So I'm really delighted to introduce and welcome Candice Lee Aronser. Candice, oh, I'm sorry, we swapped our speakers, apologies. So our next speaker is John Miracle Sacco, and John is the Freetown Climate Resilience Advisor with C40 Cities. And we're delighted to welcome John. He's going to be presenting to us about moving from policy to practice and sharing experiences from Freetown on heat health governance and integrated action. Over to you, John. Welcome.
Yeah, thank you, Hadi. My name is John Miracle Sacco from Freetown, Sierra Leone. I'm here representing the Chief Heat Officer of Freetown, Eugenia Cabo. I would like to start with, I want to begin with the woman who is selling in the market. In Freetown, most of our market spaces, we have street trading, which is ongoing in the city, and that is a big problem with heat, considering the heat. So the heat here will affect the market women sitting down besides products. So that's a big issue here in Freetown. So the heat will disturb most the woman sitting close to the market, and also the product, especially for those that are selling perishable goods. So our work in Freetown has been about turning the live knowledge into policy, and then turning the policy also into implementation that is on ground work. So the next slide, please. Okay. Freetown is one of the fastest warming city in West Africa, and burden is not equally shared between the rich and that of the poor. And for example, for those that are high class, they have ACs in their homes, and those that are not, they don't have ACs, so they feel the impact of heat the more than those that are up there. So it falls hardest on that of the market women, as I make mention of them earlier on, and also how the workers and informal settlements, communities, people who cannot afford, as what I say, the AC to cool off their systems. So we start with the policy here in Freetown. We start with the policy in partnership with the C40 and the HERA. So we develop a heat action plan for the city. So the first of its kind in Africa, and it's not just a document. It puts together all actions, and it has targets. And one of the targets here is to cut down the impact of urban heat on women and vulnerable population or communities by 60% by 2030. So, and the plan is already producing results on the ground. For example, I can make mention of the shade cover project that was implemented. And as you can see, over about 7 degrees was reduced by the shade cover market, by the shade cover project, which reduces the heat in the market, because as I said earlier on, we are having a lot of street hawkers, that people that normally sell in the street, because street trading in Freetown in particular is domineering. So, and the shade cover project, those that are benefited directly to the shade cover project are up to 3,000, the direct one that are sitting under the shade cover, and the indirect one that benefit into this one are up to 15,000. The indirect I can see here is that those that come to the market and do their daily their daily buying into the market. So most of them also benefited indirectly into this market by taking refuge under this shade cover project. Next slide, please. Okay. How we govern heat. How we govern it. We have 4 principles that we use in Freetown as Freetown. We have 4 principles. One, start with the people most affected. Like I make mention earlier on, the market women. The market women understood the risk before the data itself, because for them, according to them, they understand that, oh, I'm hot, so I need to pull off from this particular heat that is giving me burden, and their knowledge shaped better than the data we collected, because for them the preferred solution, they already have their solutions that they normally apply when using this, when trying to cool off from the heat. So this is not about a top-bottom approach, but is a bottom-top approach that the city is currently using. The second here we are talking about here is the heat governance requires coordination across sectors. Heat does not sit neatly in one department. It's churches, health, infrastructure, environment, and urban planning at the same time. So without collaboration with this department or that department, so you cannot fight heat alone as a single unit or a single office. The third here is combining cooling with economic value. Cooling with economic value here we are talking about here. For example, the shade cover I make mention of. The shade cover there is just helping to reduce the temperatures of the market. So what we do here is that we include solar, which provide light into the market, and also we use biodigesters that normally convert this, that produces heat for the cooling processes for their cooling, like their refrigerators, for those that are selling perishable goods like meat and fish. So this also help to benefit the market women. The fourth one that I would like to talk about is on the data drive investment. Our urban heat island mapping, which was done by HERA and C40, supported by HERA and C40, supporting the city of Freetown, which was done, I think, in 2024, also helped the city, provide the city with a lot of data that help the city to know which localities is affected the more and which locality is not affected that much, and especially for those living in deprived communities are more affected, and also the market women that are selling, the outdoor workers and all other entities, the young, the old, the elderly are most affected in these communities. The next slide, please. Integrated action on the next slide, please. Okay. Integrated action on the ground. How does this happen now? Now, in Freetown, we've created the Freetown Heat Pavilion, a first of its kind public pool space in Freetown, which is being replicated in Pennsylvania, in Liberia also, which is impacting the community in a greater way. And the pavilion, the second image the first image, sorry, I'm talking about the first image as you've seen in the slide. The second image here is the co-designing in action. Like, for example, we don't just bring solution to the community, but we involve the community in co-designing some of this intervention, some of these designs that we're using in some of these communities. So we do a co-designing also. And the last picture, which is the political leadership. And with all this, we need a political buy-in from the mayor and other sectors or other institution, international coordination, and also the Freetown City Council, some departments, and also some other agencies and NGOs within the Freetown municipalities. So with all this collaboration, we will help the city to achieve what they are trying to achieve, what we are trying to achieve as a city in trying to mitigate this heat effect on our society. Next slide, please. Next slide, please. Okay. What's next? Deepen heat health governance. Now, so we are going to think of ideas that the heat action plan has preferred to us or has identified to us for us to implement after all engagements being done. Now we turn markets into resident hub. Initially, biodigesters that convert market waste into energy and fertilizer and solar power, cool rooms that protect the produce and raise income. So now, as I mentioned earlier on, this biodigesters is really helping the communities and that of their product. So as a city, we thought it fit that we just started a pilot project in one market where we have up to 42 markets across the city. So I think if we have more funding as a city to replicate some of this intervention in some other markets, I think it will help a lot in doing that. And also the city is also planning to do a multi-sectorial health heat health task force. These are young people that will represent the city in some of these communities and trying to preach some of this the effect of heat on the individuals that are found in these communities. So I think this will help also the frontline readiness and that of the early warning and data systems. We partner with the Meteorological Agency in Freetown, because the Meteorological Agency in Freetown are disseminating information to the public that we are having high extreme heat at so peak, and we are having high humidities, we are having high temperatures in this peak. So the people out there will take precaution on how to prepare for short an impact on them. So I believe this is how we Freetown we in Freetown are doing our interventions on heat. I thank you all.
Thank you so much, John. Fantastic to hear of the pioneering work happening in Freetown. Really appreciate your presentation. We'll move quickly to our final speaker. I'm really delighted to introduce Candice Lee Arendse. And Candice works at the City of Cape Town. She's in the Resilience and Climate Change branch in the Risk and Resilience Department. And Candice will be sharing with us her experiences around accelerating multi-sector heat health action in Cape Town. Candice, over to you.
Thanks, Heidi, and good afternoon, everyone. I'm also standing in for our Chief Heat Officer, Albert Ferreira. Next slide, please. So I'm going to give a short overview of Cape Town's temperature profile, our heat action plan implementation and governance structures, and also some examples of actions being implemented. Next slide, please. So similar to other cities, Cape Town is projected to become hotter, which is something we have observed across a 35-year record for maximum temperature and the number of high heat days and heat waves. Next slide. This is an example of temperatures experienced in one of our communities during a heat wave we had in March. The area is characterized by low-income households and informal settlements. So in addition to the ambient temperatures, as Musa said at the beginning, we also need to consider indoor temperatures and people's ability to cool down, especially during night times. Next slide, please. Next slide. So in response to our climate projections for temperature, we developed a heat action plan, which was approved by the city manager in 2023. The plan is also a direct deliverable of our climate change action plan, which includes a broader focus area on urban cooling and heat responsiveness. Next slide, please. I'm not going to go into detail, but anyone is welcome to email us for more information. So the actions of the heat action plan are categorized into 3 main pillars and governance structures, which are risk readiness, risk response, and research and knowledge management. The 3 pillars are supported by a 4th component, which consists of additional heat reduction and mitigation levers that are embedded in other city policies, programs, and strategies. So while coordination is led by our Chief Heat Officer and the broader functions of the Resilience and Climate Change branch, implementation of these 4 work areas overlap with existing functions, programs, and budgets of departments. And in the 3rd row of blocks, I've just highlighted some examples of existing department functions and programs that are also actions in our heat action plan. Next slide, please. So for examples on implementation, I'm going to focus on community work that's happening through our heat health communication and outreach plan. Next slide. So we have a Beat the Heat media campaign that has a pretty good and far reach, but it's not reaching all of our vulnerable communities. So our outreach programs complement the media campaign, and it gives us a chance to have face-to-face conversations with communities about lived experience, access to information, and program impact. That informs how we do things, which groups we target, the content, it shapes our program. The outreach work is a multi-department collaboration led by the environmental department, the environmental management department, disaster risk management, risk and resilience, which is my department, and sustainable energy markets. And while we are trying to integrate heat awareness into the outreach programs of other departments, environmental management, disaster risk management, and risk and resilience remain the main coordinating departments, almost like a task team. Next slide. So we are also working on a few new projects that we're hoping to implement by the coming summer. And the main concept surrounding these projects is about combining resources and capacity and partners to extend reach, enhance impact, and to basically try and reduce pressure on capacity and budgets of one department. Some of the planned projects include a place-based heat smart initiative that targets 3 of our hottest areas. Part of this project is also exploring the concept of microforest. We are also developing a Be a Chomi program. That is the Cape Town version of the Be a Buddy program that the City of New York developed. And we are planning to expand our outreach work to include workshops with city workers in partnerships with our occupational health and safety department. So that program is being developed to fill a gap while our occupational health and safety department is doing an amazing job on heat and mainstreaming heat across OHS functions in the city. There's a gap in reaching outdoor workers. So that's what this program is trying to fill. And next slide, please. And just lastly, In terms of financing and to align with what we are promoting internally, our infrastructure investment program includes about 477 projects that contributes to improving climate resilience, including heat. And in addition to that, beyond the budgets, we are also working towards attracting international funding and technical support. This was my last slide. The next slide is just a thank you slide with our, thank you.
Candice, thank you so much for that presentation, and really great to see all the initiatives that are being deployed here locally. We have gone over a few minutes, so apologies for that. I'd like to thank all the speakers and just hand over to my colleague Kate for some quick closing reflections. Kate.
Thanks, Heidi. So yeah, I get the lovely job of doing some closing reflections from today's fantastic webinar. And as we close today's webinar, I think one message that really stands out clearly is heat is no longer a future climate risk. It's a present day urban emergency. And I think unlike floods, storms, drought, heat often arise without the dramatic headlines. I mean, we've really seen in South Africa this week, we're expecting floods again in the Western Cape, and there's already headlines around it. Yet heat quietly affects our health, our economies, our infrastructure, and our quality of life. And it really reduces productivity, as we've heard today, and places really immense pressure on our healthcare systems. It disrupts essential services and disproportionately impacts those who are already vulnerable, as we've heard from some of the examples in Freetown and Tanzania. Today, we've heard compelling evidence that heat is affecting, as I said, not only the poor, but the systems that they depend on. It's increasing demand on our emergency services, placing pressure on our healthcare workers, and really, as we also said, threatening medicine and vaccine storage and transportation, exposing vulnerabilities in our water and electricity systems. And this reinforces the urgent need to build climate resilient health systems as a core part of urban resilience. But perhaps one of the most important lessons that I've really taken from today's discussion is that heat is not just a climate issue, it's not just a health issue. Heat is a governance issue, a planning issue, a housing issue, a labor issue, a social issue. And addressing heat requires collaboration across departments, across sectors. Climate officials cannot do it alone. Health departments cannot do it alone. Urban planners, disaster management teams, our utility providers, social development practitioners, our community organizations, researchers, and political leaders all have a role to play. And we've heard encouraging examples of cities moving from risk, developing heat action plans, strengthening early warning systems, training healthcare workers, improving emergency response protocols, investing in cooler and healthier urban environments. And these examples remind us that solutions already exist, but early warnings alone are not enough. A warning must really trigger action. And I think this was mentioned by Bradley. When temperatures rise, communities need to know what to do. Our healthcare systems need to be prepared. Vulnerable groups need support. City services need to respond. The real measure of success is not whether we can predict a heat wave, but whether we can protect people when it arrives. And we've also been reminded that heat is deeply unequal. The impacts are not shared equally between the wealthy and the poor communities. Women working in informal markets, outdoor workers, our elderly, young children, people living in our informal settlements, and those with limited access to cooling often face the greatest risk despite contributing the least to climate change. And this is why equity must remain at the center of our heat action. I think another powerful message today has been the importance of working with communities rather than designing solutions for them. The most successful interventions are those that are co-created, locally relevant, and grounded in lived experiences. And communities not simply beneficiaries of heat action, they really are essential partners in building resilience. I'm encouraged by the growing investment in knowledge and capacity building that we've heard about today, developing climate smart health professionals, I think it was called, equipping frontline healthcare workers, and creating accessible training opportunities which is critical if we are to meet the scale of this challenge in Africa. So as African cities continue to grow, the choices we make today will really shape the heat vulnerability of future generations. If I think about it, every tree planted, every shade of public space created, every clinic strengthened, every early warning system activated, every community empowered contributes to a more resilient African future. So I think let's leave this discussion with a sense of urgency, but also with a sense of possibility. Because while African cities are heating fast, they're also innovating fast, as we've heard today. And the challenge before us is significant, but it's also an opportunity to create healthier, more equitable, more resilient cities for all. So I'd just like to thank each of our speakers, partners, participants for really contributing to this important conversation. And let's not end the discussion here, but the continuation of this movement to accelerate urban action, heat, and health across Africa. So I think my closing is around the fact that the evidence is clear, but solutions are emerging, and we need to act collaboratively together now. So thank you, Heidi, for allowing me to wrap this fantastic session up.
Thank you, Kate, and thank you everyone for staying with us. And yeah, I look forward to sharing the presentation and the outcomes with all of you. Thanks everyone, and goodbye.